Hello, everyone. Thank you for joining our PCMH peer-to-peer learning session call today. I hope everyone had a great Memorial Day weekend. A few teleconference reminders. Please mute your phone when you're not speaking, and do not put your phone on hold if you can, because then we might hear your hold music. Our agenda for today are welcome, PCMH update, a presentation from Justin from SHARE, and some time for questions and open mic. Support has been provided by Arkansas Medicaid, and we'll have a quick PCMH update. Most of this has already been, you saw in the email that I sent out when I sent out this call and information, but just in case you didn't get a chance to read this, the process for validation visits will remain the same. I know there was talk about having the visits be unannounced, and that will not be the case. The QA will contact you and schedule your validation visits before they come. The next round of PCMH reports should be released around June 28th. Please remember to complete your Arkansas Medicaid 6-month activities in the AHIN portal by June 30th. The 2017 Medicaid PCMH program enrollment and re-enrollment will be held August 15th through October 31st, 2006. And just as a reminder, a lot of your frequently asked questions can be found on this link here, the paymentinitiative.org/medicalhomes pages /facts. And for newborn patients waiting for ID assignment, if you have a newborn patient that's been waiting at least 45 days for their Medicaid number, send a secure email to your AFMC provider rep and include the following information: the parent name, the child's date of birth, and county of residence. Just wondering if anyone has any questions on any PCMH announcements. Okay, great. We're going to move on to a SHARE presentation from Justin Valin. I always mispronounce your last name. Is it Valin?
Valin.
Thanks, Justin. I'm sorry. And thank you so much for being here. Sorry, go ahead.
I said that's no problem, everybody. If it just starts with a V, I'm good. I'll answer.
Well, thank you, Justin, so much. And thanks for being here and letting us see your SHARE presentation, and just let me know when you'd like me to go ahead to the next slide.
Okay. Thank you so much, everyone. I really appreciate that. I know that I'll go a brief overview for anyone that's new that hasn't heard about SHARE or how it was made available for the state of Arkansas, but then also go into where we are, how we're progressing in behavioral health, give an update on that. And then I actually wanted to dive in to do a demo. So I'll go through some of the slides quickly. If you have any questions, I'm really informal type guy, so please just let me know. So we'll go over the introduction, do an overview, talk about the event notifications, give you an update of how we're progressing with our ONC $2.6 million cooperative agreement grant we got this last fall, how we're meeting those deliverables, and then how we're collaborating. On the phone here as well, we have Adrienne Jones. She's our accounts manager. I wanted just to let her do a brief introduction just so you know who she is, what her role here is at SHARE, and how she can always be there to assist. So Adrienne?
Good morning. Again, my name is Adrienne Jones. I'm the account manager for SHARE, and I am the point of contact for ensuring that you are receiving the service that you need in order to improve the health of our state. As the SHARE liaison, you are able to contact me with any questions, any comments, or any concerns that you have regarding the service that SHARE provides to your facility. I'm always looking for feedback so that we can improve as a part of SHARE. So any information that you would like to share with me regarding our services, and I welcome you to provide that feedback to me at any time. I can be reached via a phone or via email, and I can provide my information to you. And I am just here to just make sure that we are improving the quality and the coordination of our patients with SHARE, and I look forward to working with each of you.
Thanks, Adrienne. I appreciate that. Next slide, Kristen. All right, for anyone that doesn't know what SHARE is, SHARE stands for the State Health Alliance for Records Exchange. There's only one HIE in the state. and that is SHARE. Next slide. SHARE was established by Act 891 in 2011 by executive order for Governor Beebe. It's governed by an HIE council, and the HIE council is for each governor. He appoints those HIE council members. Their various roles around the state, and they're the ones who we give an update to, and they help guide us to make sure that we're following how we want the state to progress. SHARE is funded by public funds and small user fees. We go after grants as well, and I'll talk about the $2.6 million grant that we got from Department of Health and Human Services to expand that interoperability to behavioral health, anyone in the LTPAC space, and some of the EPs that missed out on some meaningful use monies. Our infrastructure really is to work with anyone, providers, labs, pharmacies, and public health, and we're continuous to expand. I'll talk about that expansion later on. And then we're available to any healthcare entity willing to follow our requirements and pay the small user fees. Next slide. So on here, it may be a little distorted, but you can see on the left-hand side that it is a convoluted, I always like convoluted mess, you know, trying to figure out what's going on and that clear coordination. But essentially with SHARE, we're that channel. So for a lot of the pediatric facilities, you know, immunizations is a you know, having that duplicate entry in WebIZ. Well, we have that channel directly to the public health. So I encourage you, if you're using SHARE and you want to integrate with SHARE with your electronic health record, that we get you guys set up and that we can get you on the list with the health department so that we can get those immunizations flowing from your EHR to the health department. So we're that channel that makes information available to you in real time, and we're continuous to expand. Next slide. So our infrastructure is to work with providers, you know, pharmacies, public health. It's available, SHARE is available to any healthcare entities. We're working with an ACO. We're working with some pharmacies already that's connected, behavioral health, long-term care. We can work with any EHR. So I say that is we are vendor agnostic. Now, if with integration, it has to, the electronic health record vendor has to meet some of the requirements in order to make that connection work. And some electronic health records out in the space right now just aren't able to do that. And we're continuing to evolve with a lot of different functions and functionalities, which I'll show you here later on through the demo. Next slide. On average, you may, this was a stat that, which, you know, when you put it all in perspective, an average number of providers each U.S. patient sees in a year is around 18. So you can see that's a lot of information flowing all over the place. Well, essentially, our goal is to get all of those individuals connected so that we could share the information securely and going point to point to those providers that need it in real time. Next slide. For anyone that does not know, some information that can be shared is those clinical data summary, clinical care summaries, referrals using our secure messaging, medications, allergies, transcribed documents, immunizations, et cetera. Also connecting to the ADH registries. Right now, ADH has the immunization registry up, their cancer registry, syndromic registry, and electronic lab registry. Several clinics in the state are using SHARE to be able to help meet a lot of their meaningful use measures. If anyone has questions on some of the meaningful use objectives, we have a list on sharearkansas.com, and they are available there on some of the objectives we're able to help meet. Next slide. So essentially, I always like to look at it. It's what it comes down to. It's all about the patient and to improve that patient care. So essentially, yes, it saves time and saves money by having all those records, but it really reduces the burden of those faxes, et cetera. And I'll tell you the uptake we've had and some of the collaborations we're doing in the behavioral health space, which I know is a big referral source for everyone in the pediatric world. And really, at the end of the day, to improve those health outcomes so we can have healthier kids in our state. Next slide. So the ways to share, we have our secure messaging, and I'll demo and I'll show you secure messaging. We have our virtual health record. That's a query-based system. Those are both web-based, so you could be on Apple, you can be on Chrome, et cetera, wherever you have an internet. Enter your username and password and be able to send a secure message through secure messaging, or you'll be able to query a patient in real time to figure out what happened at UMS or Children's Hospital. Or we have that integration with your electronic health record, so that information flows directly into your electronic health record. In many instances, that's bidirectional. So not only are you consuming that data, but you're also able to send information out of your EHR to those various entities such as behavioral health. Or we do the CCD, continuity of care document, or CCDA, which is a parsable document, and we allow that through an integration which helps meet transitions of care and also a meaningful use requirement. Next slide. Just wanted to share with you all the event notifications. We have been getting an uptake with getting hospitals being able to, especially the patient-centered medical home, Medicaid, anyone that's in that program, sending event notifications. For anyone that's on the call, we have listened to you. You know, I've been working with Cheryl, the pediatric clinic in Benton, and getting feedback from various clinics, and we were able to identify and work with hospitals. So now the event notifications are not coming from their ancillary departments, such as when they admit them for lab or admit them to their dental at Children's Hospital, but it's going to be strictly for the event notification will alert you specifically for a patient that is admitted to the ED, discharged from the ED, or that has been discharged from an inpatient stay. So we've been able to filter those out working with the various hospitals in the state. So you should see a very streamlined process for all of your event notifications. So event notifications just from in May 1st through the 31st, we've had a total of 16,000 alerting all of the providers that's in the PCMH program when their patients went. So the emails that you may be getting, you know, from Share, and it has the name and the title, or you're in your regular work email, just want to reiterate, those are actually patients. Those are patients that are either went to the ED or been discharged from the inpatient. So this is really to help you meet your 10-day follow-up, but then also just to get them back in the clinic, or just make a simple phone call to find out what's going on and make sure that those children are okay talking to their parents, et cetera. Next slide. Again, I wanted to introduce Adrian, our accounts manager, but essentially secure message and VHR training. If you need additional training, we're available all the time. We have a web link if you need to go through training again, or it's been a little while and you're a little rusty. We have morning and afternoon times available. It's available through webinar. We have an in-house trainer. You can register for that. If you need to add any additional employees, please let us know, and then you're able to add those users. If you have new care coordinators, a new referral coordinator, please let us know. Or if you need other people to receive the event notifications alerting you when your patients go or your children go to the ED or to the inpatient discharge, we can have multiple people at your clinic level to receive those notifications. So if any time that you have that, please let myself or Adrian know, and we can get that changed so you are able to receive those alerts. Next slide. So who shares? Next slide. We've got a great uptake. Now we have close to, it's actually almost to 1.9 million unique Arkansans flowing through Share, participating. So they continue to grow. I always like to look at, right now, we're over half of the state's population flowing through. Next slide. We have a total of 38 total hospital sites. This is of May. We've actually increased this. In the last 2 weeks, we've went live with St. Bernard's, Cross Ridge, and Lawrence County up in the northeast sector, sending ADTs, alerting our PCMHs. Washington Regional up in Northwest has went live as well, sending ADTs, so alerting our PCMHs when those occur. We've gotten verbal agreements from community health systems, so they own the Bentonville, Springdale, the Northwest, Siloam Springs, and Sparks. We're working with their corporate now to get them connected. We've also gotten verbal agreements from the Baptist system as well, so that's 7 hospitals. We're waiting on their agreements right now. Currently, we have 646 total sites, 477 live, 169 implementing, and this is continuous to grow. Next slide. Behavioral health providers, we're working with them in collaboration with Arkansas Medicaid and Beacon Health Options, which is their vendor that helps them. So through our cooperative agreement grant that we got from Department of Health and Human Services, we have been able to expand our reach to behavioral health and then get them on, because a lot of them have missed out on meaningful use monies. Most are still paper-based, and some are incorporating the EHR in their system. But they want to be able to communicate with all of our pediatric practices that are connected to streamline the process in doing referrals. Also being able to share that patient information back to the PCP so you know what's going on with that patient. You could do a medication reconciliation, et cetera. So right now we have a total of 70 total sites of behavioral health. We have the Mid-South, we have Perspectives, we have Pathfinder. We're working with many others to get live. I had a call with community counseling earlier before this call to get their 4 sites connected. So in total, we've done, besides the one we've gotten implementing or live, we've done outreach of demo or participation agreement in hand to around 113 sites in our state. So we're continuously getting growth. We have Pinnacle Point live, Methodist and Maumelle inpatient live. Bridgeway and Riverdale will come on very soon. They're implementing at this time, and then Springwoods and Fayetteville will also come live. We did a demo recently with Vantage Point up in Northwest and Fayetteville. They're inpatient and there's 7 or 8 outpatient clinics, so we're hopefully to work with them and several of the other Acadia healthcare sites throughout the state. Next slide. Here are some of our connected hospitals and connecting. You can go to sharearkansas.com. We try to get this updated as it continues to grow and learn about who is connected throughout our state. Next slide. Some of the provider practices as well, you know, listing 647 is a little hard, so I encourage you to go to sharearkansas.com, or please reach out to Adrian and myself. We'll continuously do an outreach throughout our state with our operations team. So if there's anyone that you say, well, we do a lot of referrals to this one, can you please do outreach to them? Can you get them connected, because we want to streamline our process and you share to help us in that? Don't hesitate to call us, because we don't stop with just getting you connected. We want to get the whole state connected and really streamline the process to make your lives easier. Next slide. So behavioral health, what are we doing? Next slide. So we have come, based upon the grant, we have a behavioral health strategy in our state, and I know behavioral health is a big referral source for a lot of pediatricians. So we're working with Arkansas Department of Behavioral Health, BBHS, Arkansas Medicaid, the Arkansas Community Mental Health Centers, and DHS to really look at ways that they can utilize SHARE to really streamline the process to help the pediatricians throughout our state. Getting that information back to when you need it, streamlining the referrals, so doing away with faxing and phone calls, so you're able to send that securely and keep track of all the referrals, et cetera, in real time. Next slide. We're also doing a pilot with the RSPMI providers, getting all of them connected. We're doing this in collaboration with Beacon Health Options, which many of you may have known as value options in our state. We're working in collaboration with them and Arkansas Medicaid, as many of the RSPMI providers see the Medicaid population, to get all of those connected, those facility sites, so that they can be able to share securely using secure messaging to our connected pediatrician offices, et cetera. We've gotten a large uptake with this. Adrian and myself are doing demos as we did earlier and talks with all of these individuals. We have a meeting tomorrow with Ascent Healthcare up in the Northeast Quadrant down to Little Rock with Dan Sullivan to show the value and what he can help streamline his processes. Again, you know, we have individuals such as all the Mid-South, all the Pathfinders, and the Perspectives as some. Next slide. All right, so I wanted to go through that really quickly, not too bad, but I wanted to be able to demo Share. I wanted to show you what secure messaging in the provider directory looks like, how you can look at how you can delegate your providers to your coordinators, et cetera, and then also how to pull up a patient in our virtual health record to when you get an event notification, you're able to then look up that patient and what that actually looks like. So is there a way, Kristen, that you can pass me as a presenter?
Sure. Okay, let me know if that worked. Hopefully I'll be able to see your screen come up on ours.
Can you see my screen?
I cannot see your screen.
What about now?
Now I think I'm still on mine, so let me try to do that one more time.
Okay. While Kristen's doing that, do I have any questions or anyone out in the field that's connected or have questions about Share?
Justin, do you have a something at the top of your page that has just something that shows you, that says that your screen is now being shown? Does it say that on the top of your screen?
No, it did come up a minute ago and then it disappeared.
Disappeared? Well,
yep.
Why don't you scroll your mouse to the very top of your computer screen and see if it comes back, because I think that it's not even letting me. Oh, there we go. Okay, I think it might be starting to show. It's just, here we go. Okay, we can see your screen now. Thanks, Justin.
Okay,
and if you could, when you're done, just pass it on back, because I think I've lost control of the webinar, so just if you can. Thanks,
That
Justin.
is not a problem. Thanks, everyone. So I wanted to just show you how easy it is to log into secure messaging in the VHR. So when you do get those event notifications, and just for everyone's information, I'm working with, I get the patient attribution from Medicaid every month, so I attribute those to your PCPs. That which allows to get your event notifications when they go to Washington Regional, St. Bernard's, Cross Ridge, UMS, St. Vincent Children's. At that time, then you're able to toggle over to our virtual health record and be able to see what occurred. So you go to sharearkansas.com, you can go to any internet browser, whether it's Explorer, Apple, Chrome, etc., and you go into the login. If you have additional users or that need access, please don't hesitate to call me or Adrian, email us to let us know, and we can help guide you in the process. So I'm going to click on to Share. Each user, again, as you probably, many of you are already aware, you have your username and password. You're going to log in. I'm not going to click on anything here, but I wanted to take your attention to how easy it is to look up people and be able to send a message. But before I do that, for all of your providers that get emails or for anyone that you want to add, those email addresses can be delegated to your care coordinator or your PCMH coordinator in your clinic. So I know that providers are very busy, et cetera, so you can delegate that mailbox. So if you go down to the corner like I did and hit settings, you can actually go to delegation, click on there, and it's waiting, and then you can put in your actual username. So I saw Lori Hodge on. If Lori wanted to take over and receive the notifications from the providers, that she can put in her actual username, so whether it's lori.hodge, and then be able to save that. That way, if any of the providers get a message from other PCPs, et cetera, that it can go and be addressed by the PCMH coordinator or administrator. So I wanted to take you to that feature that can be done to any site, and you can delegate as many providers to a certain individual as need be. Whenever you get that delegation, you'll see on here on my top right screen where it has a J line. You're going to click that, and then all the mailboxes that you're delegated to, it will show here. So you can see that I'm delegated to our PCMH notification mailbox, that I can go and click on that, et cetera. So those are where you're going to go to have access to all those mailboxes. Okay, so I'm going to go back to my webmail, and we have two ways in which you can search. But I'm going to take your attention to our provider directory. Our provider directory has been increased, if you want to say, with many, many other mailboxes. If you can see on here, we have what's called open-end. So all HIEs or throughout the state that's connected and they're using the MERS platform, we have access to them. So direct email addresses around the country. We're also part of the $2.6 million cooperative agreement grant that we got from Department of Health and Human Services. We're able to coordinate with the Missouri My Healthy Access. So we have actually loaded the provider directory into their provider directory, talks to our provider directory in Missouri Health, the HIE. So you're able to, if there's providers or organizations are connected, you're able to get their secure email address, send it from your EHR, so copy it and send it from them, from your EHR, which allows you to meet some of the meaningful use transitions of care. Or you'll be able to send it a direct email address from your shared email address, and so on. So I'm going to look at Baptist Health. Right now we do have Baptist Health's directory loaded into our directory as well, even though we have all their clinics in the hospital not collected, but we do have Baptist. So I wanted just to show you this. As you can see, Paducah, this user, Baptist Health in Paducah, is connected. So they're actually sharing their direct email address as well as us. So they can toggle through anyone that uses a MERS platform. So you can see that this is a direct trust secure email. So say if you had someone come from Paducah Baptist Health, you'll be able to send them a direct message. Or you'll be able to just look up Baptist. And you'll be able to see that, you have others. Now, this goes by last name or organization name. So if you, I think it's Mercy Health, you'll be able to toggle through looking up that information. So we have Mercy Fort Smith. We have the Mercy Family Clinic. We have a Mercy Medical Center there in Kansas City. So they use Cerner Direct. We can actually have access directly to that Mercy in Kansas City if they have a patient that went there, or the Mercy Fort Smith Clinic, you're able to send them a direct message as well. So I wanted just to bring your attention here. It's now going not just here in Arkansas, but we're actually anyone that uses the MERS platform, and you can search, and we are sharing with the Missouri HIE all of their directory and vice versa. We're also in collaboration and soon to be able to do the Oklahoma HIE and be able to connect to the HIE there as well as Tennessee. So with Tennessee, you'll be able to get those event notifications and alerts. So any pediatrician that's there that goes to Le Bonheur, Baptist, or Methodist over in Memphis area, you'll be able to be alerted when your patients go into the ED or inpatient discharge. Oklahoma, we're working to work with them so that you can actually query your patients and their HIE is connected to ours, and you'll be able to query and vice versa. So this is the provider directory. You can look up anyone, and so if I'm in Harrison, Arkansas, and I want to look up Dr. Leslie, I can look up Dr. Leslie, and I can send a direct message to, we have all three Leslies in Harrison on, and so you're able to send a message to them securely, whether it be asking a question, et cetera. So we can look down here. It pulled up 49 Leslie, so you can see that we have many all over the nation, but we have Sharon Leslie here. She's at North Arkansas Regional Medical Center, and I want to ask a question. So I'm going to go here, and I'm going to compose And then whenever I compose the message, I'm going to be able to put in the subject line. So let's just say that myself, I'm the patient of your pediatrician. I'm going to ask about a recent discharge of that March 10th. Well, at that time, if I have any questions, maybe it's some lab values that I wasn't unaware of, or there's a little question about what occurred, I can actually attach documents. Now, if you can look here at the bottom, there's a maximum allowed of 50 megabytes there. So if your message is a little over that, this will just let you know that what that megabyte is, and you would send it in 2 messages. So you can attach that document, put in information as you need fit, and then send it on to Dr. Leslie. If you have a local message that you need to look at, and this is another thing where I wanted to bring your attention to, we have a recent Arkansas Pediatric of Conway recently joined SHARE, and we were able to create them not only a message for the providers and staff, but a secure mailbox that's looked after their PCMH coordinator for their clinic as a whole, but then also referrals. So if I toggle it down and I look up Arkansas Pediatrics, let's look at Arkansas. You're able to look here that I want to go to Arkansas Pediatric Conway Referrals. So I double click there, and this goes any referrals. So we're working with a lot of behavioral health in the community, and so they actually have a referrals to go to them. So what they're wanting to do is streamline their processes so that we're continuous outreach to the specialists and that they send and receive referrals from using Share Secure Message. They also have Arkansas Pediatric Conway, Daughters of Charity of Arkansas. We have UAMS, North Arkansas Rheumatology. So if for an instance that any of your offices want to add a secure message account for you as a whole, and it go to your PCMH or your care coordinator or your referral clerk, and you want to create a referral message, we can do that. So please don't hesitate to reach out to us and we can get those created so it streamlines your process. That's secure messaging. Do I have any questions on secure messaging or any comments? Okay, so I'm going to do a quick go into our virtual health record. I'm going to go out of this system because I'm going to go into my test system, but if everyone can see my toggle, the results or virtual health record will be right beside, so you don't go out of the system and come back in. So once you receive that event notification, such as myself, that I went to Little Rock Pediatrics, or I went to UMS, but I'm at Little Rock Pediatrics, and that I'm getting that alert, then you can just toggle over to find out what happened at Children's or what happened at UMS or any of the hospitals that's connected in the state. So for all intents and purposes, I toggled over and I went to look up a patient. So here, as you all know, or many of you know, that there's a primary clinical role, and that's your docs. There's a secondary clinical role, and that is your care coordinators, your nurses, anyone that needs to see PHI or is deemed appropriate to see PHI, or we have the non-clinical role. The non-clinical role will still have access to share VHR or MRSMail, but they will only be able to see demographics in the VHR. So those are the 3 types. Anytime that you have a patient emergency situation or a public health emergency, the only time that if a patient opts out or the parent opts out to have the information made available through SHARE, it's still out there. The provider will have to break the glass to be able to view what occurred. So that is the primary clinical roles. So if you need to add any of those users or any new providers in your organization, please let us know. But right, for all intents and purposes, I'm going to attest to the treatment relationship. So I'm going to pull up my test patient. He's Share Test 1. His name is Paul. Best practices is to put as much information as you have available just to make sure that you're not dealing with maybe twins or anyone that has the same birth date, same name, etc. So I know that he's Paul, he's male, here's his birth date, and I'm going to submit. It would take you, I've already looked up this patient, but say We have Kristen out there, and she's connected, and she's looked at Paul before. It won't make her attest to that treatment relationship each time because she's already attested to it as that user once before. But before going through, I'm going to toggle over. I'm going to make sure that this is the patient that I need to look at. Here is the last four of the social, et cetera, and I'm going to click and go into this patient's chart. Again, this is a test patient, but I wanted to show you this is the information that you would be able to see in the VHR. So once you get that event notification, you can toggle over to the VHR and see what those lab values, any imagery. So if we don't store the image, but if Arkansas Children's, for instance, they use a DICOM viewer, they send the link, you're able to click on that link and see the image itself. But let's go here and look at the DEXA spine. We can toggle over, you see the ordering provider, and you also see the actual source. So I'm going to double click there. And for this one, I can look at what occurred. So it's actually, it was deafened spine for the femur. The impression was osteoporosis, high fracture risk. It gives you what actually occurred, the transcription. This information was done in ARMC, discharge, time, date, et cetera. You can download this report if you're not integrated with your EHR. You can share it with any individual within your practice, send to yourself secure message, or you can download that report and upload it into their EHR or their chart. I want to take your over here to lab so we can see a basic metabolic, but you see a little an explanation port. And in this it says, if you toggle over, this report contains an interpretation code of abnormal. All right, so it alerts you that, okay, some lab that was done was abnormal. So I'm going to go here, but before I scroll down, I want to take you to the flag where it says general, low, or high. Abnormal has the explanation pointed to give a feature of if it's too low or elevated. Critical, it's an explanation point with a solid yellow, and it's either circled low or high, or if it's severe, it's in red. When I scrolled over, it showed me that the metabolic lab, there were some abnormal values. So here you can see the chloride was elevated, the CO2 was decreased, and they had an increase of anon GAP. You can see the value, the labs, the range, and when it was reported. If you scroll on down, you can also see what the performing facility was. This information, again, from this individual report, it can be downloaded from this particular test and uploaded as needed. So you can see medications, you can see the medication reconciliation, so you can reconcile what new allergies they may have, what their vitals are, any additional documentation, et cetera. It gives dates and times. Once you toggle over, you can actually see this. This information is it's not just from UMS, so as you can see through here, it's many different organizations. John Alexander Family Practice, they had a urinary calculus unspecimen diagnosis, where you see up here where they had a metabolic basic at UMS. So this is taken from all different sources that are sending information to share, puts them in this consolidated area. I wanted to also say that you can also download the whole report as a PDF. And in this, you can actually then download this or print this off for your care coordinator or upload this, and it gives you information from each of the facilities and what actually occurred. So it's this whole look of this particular patient. Do I have any questions? I wanted just to be able to show you what the VHR can do with more hospitals coming on throughout the state, alerting the PCMHs in real time, and hopefully we can get all hospitals in the state and then being able to send data and so that you're able to see what's going on. Just wanted to reiterate, though, that we do have Washington Regional sending ADTs. That's what they're sending right now. It's alerting you. They're not sending the lab values and medications, et cetera, but alerting you in real time of when their patients go to the ED and discharge. Same thing with St. Bernard's, Cross Ridge, and Lawrence County. They are live sending ADTs, so as many pediatricians around the state, you may see alerts coming from those facilities. Anytime that you want to find out what hospitals are connected, you can go to sharearkansas.com and go to Who Shares. This will give you a list of all hospitals. We do have some long-term care hospitals connected. We have the behavioral health hospitals that I've shared with you. So actually, it's a little over 40 in our state at this point, and we're continuing to grow every day. But I'm going to open the floor for any questions or any comments that you may have on secure messaging, VHR, or in Share in general. And, anybody has any questions, please let me know, or I'll just turn this back over to Kristen.
Thank you so much, Justin. And it was great to meet you, Adrian. And I'm aware of the time right now. I know this month we started the webinar a little bit late, so I just appreciate everyone who continued to stay and listen to that very important presentation. And I am, I'm not sure if the PowerPoint has gone back into my control, so I basically just wanted to ask if there were any questions either for Justin or for me about anything PCMH related, or if you had concerns or feedback.
Thanks again, Kristen and AAP, for allowing us to give a presentation and showing of how we have increased behavioral health and anyone in the LTPAC space and the PCPs and hospitals around the state. And hopefully that all the pediatric practices around the state are seeing the event notifications and seeing a value that alerting them in real time to allow their patients to get back in, or giving a simple phone call to really complete that transitions of care. And really, at the end of the day, it's essentially all about the patient. So thanks again.
Thank you. That was incredibly informative. And with that, I will end our webinar. We have a feedback form located on our website if you have any questions or concerns. And thank you very much for attending the webinar today. And we will look forward to meeting again next month. Thanks so much.